What is hypertension? Hypertension, also known as high blood pressure, is the condition caused by the narrowing of the arteries, a greater than normal blood volume, or heart irregularities, but most of the time the cause is unknown. According to the National Institute of Health, it occurs in about 65 million Americans, which is about 1 in 3 people. A healthy blood pressure should be less than 120/80, or the measure of the systolic pressure, or the beats, over the diastolic pressure, the pauses between the beats. In the article Vital Signs, Awareness and Treatment of Uncontrolled Hypertension Among Adults, when a person has high blood pressure, the systolic pressure is about 140 or above, and the diastolic pressure reads at 90 or above. Often referred to as the silent killer, hypertension is important to identify and treat before it becomes a serious health issue. I devised a 3-question survey which evaluates the person's knowledge of what happens to the body when contracting hypertension, how you can prevent it, and what diseases and problems can come about once you have hypertension. Each question would ask for 3 answers and would be scored on account of how well they answered the question out of 9 points. Also, the survey asked for their age range, 29 and lower, between 30 and 49, and 50 and above. Hopefully by taking this survey, people will realize how little they actually know about high blood pressure and look it up to keep themselves informed. Many of the symptoms are not external, so it's important for people to consult a doctor and take preventative measures before anything becomes serious. Hypertension affects your risks of... Most people understood the question was asking about disease and health problems caused by high blood pressure. The answers I was looking for were heart attacks, stroke, and failure of the kidneys. Someone at risk can damage and irritate the cells that line their arteries. When this occurs, harmful cholesterol can build up around the site and develop into a plaque deposit, causing a restriction of blood flow. When this happens, the artery can rupture, leading to internal bleeding that can cause a heart attack. If this occurs in arteries within the brain, it can lead to a stroke. Meanwhile, the kidneys are the filterers of the blood, taking out the toxins and keeping the blood fresh. Since the blood flow is poor when a person has high blood pressure, in the most extreme cases of hypertension, the kidneys are less active and more likely to shut down and die. If this occurs, the blood becomes poisoned and the kidneys must be replaced. What happens to the body systems? The answers I was looking for were impaired vision, headaches, change in the heart's shape, making it less efficient, and hardening of the arteries. Because the blood is pumping less efficiently due to its overall thickness, the heart, like any other muscle in the body, has to grow bigger and stronger to compensate for the lack of blood flow. At the same time, the arteries are getting clogged with plaque and are still trying to force enough blood through the shrinking passageways. This occurs throughout the body, including the ever-sensitive eyes and brain, causing headaches and vision problems. In extreme cases, blood vessels can pop in the eyes and cause blindness. What can I do to prevent high blood pressure? Cigarette smoke, excess alcohol consumption, fatty and salty foods, and obesity are the main external factors that can lead to hypertension. Also, unfortunately, people from African descent are more prone to getting high blood pressure, as does anyone with a family history of heart disease. Even if a person is prone to getting high blood pressure, they can still take preventative measures to slow it down. These include exercise, weight loss, quitting smoking, and limiting alcohol intake to 2 drinks a day for men and 1 for women. There are also medications that can be taken to thin the blood and decrease inflammation from plaque buildup, such as aspirin. Depending on how advanced the case of hypertension, the doctors can decide to add more medication. There are also adrenergic blockers, or a medication that decreases cardiac output and heart rate, diuretics, or urine-promoting medications, and ACE inhibitors, medication that dilates the blood vessels, to keep the high blood pressure in check. The goal of this experiment was to prove that people over the age of 50 are more knowledgeable about the problems and preventions of high blood pressure. My survey took place in a brunch setting with primarily educated white adults. I surveyed 44 people and found that the age group between 30 and 49 actually knew more than the 50 and above. Although my results could have been more accurate had I done my survey in several locations and getting more demographics, I think I was able to pique the interest of many individuals and hopefully help them begin thinking about lifelong health. After all, with heart attacks being the #1 killer in the United States and strokes holding steady in 4th place, it is important to think about the future.
When your heart is pumping hard, 'cause your blood is full of lard, hypertension, hypertension. If you're eating too much salt, then you know it's all your fault, hypertension, hypertension.